Yeah, so this was, as you may know, sickle cell disease is a risk factor for thrombosis, and pregnancy and sickle cell disease. Pregnancy is also an independent thrombosis risk factor, and so when you put them together, there's a question about what is the rate of thrombosis in pregnant people with sickle cell disease. And this is really important because we don't have disease-specific guidelines to inform anticoagulation use and care. We used a database that is pregnancies from the Mount Sinai Hospital in Toronto and the Johns Hopkins Hospital here in Baltimore, and included subjects who had carried a pregnancy for more than 20 weeks gestation and had sickle cell disease. And we looked at people who had and did not have blood clots and compared their characteristics. And so this included 290 singleton pregnancies in 199 people who were pregnant and had sickle cell disease. Most of the pregnancies were first pregnancies in people. And about 58% had sickle cell anemia. There was a 7% venous thromboembolism rate in all pregnancies. 9 events were DVT diagnosis, and 8 events were pulmonary emboli, and 3 were diagnosed with both DVT and PE. We compared the characteristics of subjects who had a VTE in pregnancy to those who did not have a VTE in pregnancy, and identified the VTE was associated with disease severity markers, which is consistent with other studies of thrombosis risk in sickle cell disease in general. In pregnancy, those risk factors included having a history of VTE before pregnancy, having acute chest during pregnancy, and having painful events requiring acute care during pregnancy. Hydroxyurea use is also a risk factor for clot in pregnancy. Again, these are all risk factors for disease, markers of disease severity. We also found that thrombosis was associated with a premature delivery. So there's a much higher rate of moderate to extreme prematurity in subjects with venous thromboembolism compared to those without. And they also had a higher C-section rate. 7% is thrombosis risk is what we conclude existed in this cohort, and it exceeds the threshold in the American Society of Hematology guidelines for initiating anticoagulation prophylaxis during pregnancy. We conclude that there's a need to address this both through guidelines that are specific to pregnant people with sickle cell disease and more explicitly in the existing ASH guidelines for the indications for anticoagulation in people with thrombosis risks.